coenzyme Q10 product, ubiquinol. We've had a webinar on this product, and it's available on YouTube for anybody who might have missed that. We have a webinar scheduled, I think it's the 24th of September, on our product NeuroBalance, so put that one in your diaries if you're interested. And today we're going to be talking about our product Homocysteine Control. And so this is a product that it's a blend of folic acid, vitamin B6 and vitamin B12. And we formulated this as an aid to preventing and reducing elevated plasma homocysteine levels. We've utilized a slow release delivery system, and obviously we're going for the most bioavailable forms of the ingredients where we can, and the formulation ensures that we get optimal blood plasma levels maintained throughout the day. So I'll give an overview of sort of homocysteine in just a minute and sort of explain a little bit about what it is and why we have issues with it. But if we just start off looking at some of the risk factors for elevated homocysteine. We know that high homocysteine levels are a reliable risk factor for a number of life-threatening conditions, including cardiovascular disease, diabetes, dementia, and depression are probably the ones that really kind of scream out at us. But obviously there are sort of various other areas that should be addressed as well, and I've just listed a few here on this slide. And again, this webinar will be available on YouTube at some point in the very near future. So you're probably aware that there are several causes of high levels of homocysteine, and we have the smoking, excessive coffee consumption. I'm not quite sure what contributes to excessive coffee, but coffee is in there. Lack of exercise, increasing age, high protein intake, and especially if it's coupled with low intake of vegetables and fruits, folate, B6 and B12 deficiency, and various drugs can cause elevated homocysteine levels as well. So some cholesterol lowering products and some of the treatments that are associated with Parkinson's disease, for example, and anti-epileptic. We've got a few up in the corner here which are probably less sort of known about. So we've got things like hypothyroidism, we've got renal disease and certain types of cancer, psoriasis. Not quite sure why some of these contribute, but they're certainly in the list. And then we look at some of the sort of genetics of homocysteine metabolism and the various gene-nutrient interactions. For example, individuals who are homozygous, for methylene tetrahydrofolate reductase, I beg your pardon, especially if it's coupled with low folate status. And there are a couple of other enzymes that are involved in homocysteine metabolism, which I'm going to go through in a minute. Low levels of those, either through genetic polymorphisms or through low levels of cofactors required for them. But like I said, I'll just discuss those very, very briefly in just a moment. So let's just have a quick chat about homocysteine. When proteins are digested, they get broken down into individual amino acids, including the essential amino acid methionine. This is then broken down further by several methylation steps, and it produces homocysteine. So homocysteine is just a natural byproduct of the methylation cycle. The methylation cycle itself is a process that is incredibly important for the production of neurotransmitters. It's involved in cell cycle control, the synthesis of nerve proteins, and liver detoxification processes. And it acts by switching and sort of turning on and off genes, or sort of epigenetics. And the process of methylation regulates lots of different systems within the body. So if we have a quick sort of overview of the methylation cycle. So we have our protein, which enters from the diet. We get the breakdown into methionine. and the first step of methionine breakdown, and it receives an adenosine group, giving rise to S-adenosylmethionine, or SAMe as it's better known. And then SAMe acts as a methyl donor, so it loses a methyl, and that can go off to any accepting molecule such as protein or DNA. SAMe is incredibly important at this process, or in this process, as it's the direct precursor to neurotransmitters, for example, serotonin, melatonin, dopamine, and so on. Adenosine is then hydrolyzed that then converts through to S-adenosyl homocysteine in that part there. So we then lose an adenosine and converts through to homocysteine. And at this point, homocysteine has two fates. It can convert back through to methionine, or it can convert to cysteine and act as a precursor to glutathione, an antioxidant glutathione. And as you can see, I've highlighted in red here some of the vitamins that are involved in this process. So we've got vitamin B12 involved in breaking down homocysteine back to methionine. We have vitamin B6 and folate entering into the folate cycle, and we have vitamin B6 involved in the production of glutathione. And this is generally where we have blocks. We also have important enzymes in here. I mentioned them briefly earlier. I don't know whether you can read those properly, but we have methionine synthase, and we have another enzyme here involved in breaking down homocysteine into cysteine, and then we have the sort of pretty well known one, methyl tetrahydroreductase. So if we look at measuring homocysteine, we tend to relate to total levels of plasma homocysteine. And it exists in several forms, but in the plasma it actually becomes rapidly oxidized and exists in several forms, mainly as a disulfide with the protein albumin. Normal range is anywhere between 5 and 15, that's an acceptable range. Mild elevated homocysteine is considered to be 15 to 30, and then we go up to severe homocysteine, over 100 micromoles per litre. So if we look at homocysteine and cardiovascular disease, there have been studies over the past 10-20 years that have related elevated homocysteine as a risk marker for cardiovascular disease. And this association was first noted in patients with cystathionine B synthase deficiency, and this is the enzyme that breaks or is involved in converting homocysteine into cysteine for the production of glutathione. Individuals with a deficiency in this enzyme tended to have premature cardiovascular disease. Genetic polymorphisms, as I've mentioned, do occur in several other enzymes related to homocysteine metabolism, and they're also known to increase homocysteine levels. And again, several enzymes related to homocysteine metabolism require the presence of folate, vitamin B6, and vitamin B12. One of the most significant risk factors for elevated homocysteine levels are polymorphisms in this enzyme, and it's involved in converting folate into the active form of folate. And it's a common cause of mild or moderate or polymorphisms in this enzyme are related to common causes of mild or moderately elevated plasma homocysteine levels. 10% of the population are homozygous, 43% are heterozygous, 47%, so about just under half of the population are actually unaffected. So if you are heterozygous, you're probably going to have slightly higher levels of homocysteine than those individuals who are unaffected. But if you are homozygous, then you are likely to have approximately 20% higher homocysteine levels. However, unless you know your genetic makeup for this enzyme, then it's very unlikely that you're going to know whether your homocysteine levels are elevated. Interestingly, this is really kind of coupled with low folate status. So if you have plenty of folate in your diet, then you can manage homocysteine levels. So it's just really kind of an example. So what's so bad about homocysteine in regards to cardiovascular disease? How does it actually injure the blood vessels? Homocysteine is a thiol, and so it can undergo either autooxidation or oxidation with other thiols, and this results in increased oxidative stress. Homocysteine also is known to limit the bioavailability of nitric oxide, and this results in the impairment of normal vasodilation of blood vessels. Homocysteine damages cholesterol, and it also increases clotting, which may then obviously lead to stroke. Homocysteine is also involved in the initiation of inflammatory cascades. It gives rise, or it induces the expression and secretion of various inflammatory end products. So we have chemoattractant proteins and interleukin. In regards to mood disorders, we know that low folate and B12 are involved in the remethylation of homocysteine to methionine. This then gets converted to S-adenosylmethionine, which is SAMe, which you can also get in supplement form. And SAMe acts as a donator of methyl groups that are involved in the formation of neurotransmitters, including serotonin and dopamine. And these are crucial for normal brain function, for normal neurological function. We know that low folate, B6 and B12, now this is either in combination or individually, are associated with low SAMe and can impair normal neurotransmitter function. And in fact, low levels of individual vitamins or in combination give rise to elevated homocysteine levels, and we know that this is common in major depression. So we have serotonin and dopamine and various other brain chemicals that require constant methylation, and so if homocysteine isn't recycled to methionine, this impacts negatively on SAMe levels, and this in turn will impact on neurotransmitter production. And this is not just for mood regulation, but it's also required for sleep. Interestingly, depressed people with the highest levels of homocysteine will generally have the lowest levels of SAMe. Elevated homocysteine, as I've said, also increases oxidative stress, and homocysteine is also known to be neurotoxic. So in combined with this sort of neurotoxicity and increased inflammation, this in turn can also promote the development of depression or increase the risk of developing depression. So there's substantial evidence for common decrease in red blood cell membranes of certainly of vitamin B12 in plasma homocysteine levels, and we also know that various polymorphisms that impair homocysteine metabolism are overexpressed in depressed patients, and this kind of strengthens this association. And so there's a lot of interest in B6, B12 and folate as a sort of add-on treatment for the treatment of depression, and there's an ongoing study at the moment called the B-Vitage study, and they are using 2 milligrams of folic acid, 25 milligrams of B6 and half a milligram of B12, and that's an ongoing study, so hopefully they'll have some nice results that maybe we can discuss at a later time. And so when we're talking about cognitive decline, we're talking about conditions such as dementia and Alzheimer's disease, for example. Certainly vascular dementia is in there. We know that there's a significant correlation between the risk of developing dementia and levels of homocysteine and low levels of folic acid, B6, and B12. The mechanisms or the sort of outcomes are similar to some extent as those that are described as risk factors for depression in regards to the neurotransmitters that are produced. But we also know that low SAMI and hypomethylation of numerous substances, including DNA and proteins, can impact on vascular structures and has a negative outcome on neurogenesis. And this leads to increased susceptibility to damage and programmed cell death. So it's not surprising that if high levels of homocysteine are related to poor methylation processes that are related to conditions such as dementia, depression, cardiovascular health issues. It's no wonder really that sort of supplementing with these 3 vitamins not only gains a lot of interest, but has actually been clinically shown to significantly reduce homocysteine levels. However, there are numerous studies that have successfully shown reduced levels of homocysteine in combination or as a result of supplementing with these 3 nutrients. Some have paired particular nutrients up, some have used individual nutrients, and some have used 3 in combo. But there is considerable variation of dose between these studies, and so at this current time there's no really established fixed dose of each nutrient or in combination that is really being suggested. In developing homocysteine control, we've looked at numerous studies, and we feel that a product that delivers at least 0.9 milligrams of folic acid, 24 milligrams of B6 and 0.9 milligrams of B12 to be a safe and effective treatment that may lower homocysteine. It not only satisfies the RDA, but it doesn't exceed the tolerable upper limit. In regards to homocysteine control, currently we have 2 health stacks that we've incorporated it into. For those of you who are familiar with our products, it sits very nicely as a complementary co-therapy with our PharMEPA Restore and Maintain treatment protocol, so co-therapy with EPA and GLA. In our cardiovascular health stack, so currently we've got our PharMEPA Restore and Maintain, we've got Homocysteine Control, and we have our specialized coenzyme Q10 product, vesisorbubiquinol. And sitting under mood disorders, we've got our PharMEPA Restore and Maintain, and we've got our additional homocysteine control. Neurodevelopmental disorders, I'll be speaking about Neurobalance, our new product, to complement our Fajipa products on the 24th of the month. So in regards to where this product sits, we need to sort of really look at the role and benefits of maintaining a nice healthy methylation cycle, and so this is kind of the key areas that I've really sort of spoke about and mentioned. So we have neurotransmitter production, we're looking at mood, memory, learning, but it also goes obviously with serotonin into gut function. Incredibly important when we're looking at antioxidant activity. We need to increase glutathione production by reducing homocysteine levels, and this in turn will reduce free radical production, so incredibly good for sort of whole antioxidant activity. Obviously the sort of cardioprotective aspects of lowering homocysteine levels and stroke. In regards to glutathione, we also go on to detoxification, so we get improved liver function, increased energy, and improved sleep, and then through to sort of neuroprotection, cell signaling, cell cycle control, anti-inflammatory. SAMI is also involved greatly in the production of products that are known to influence joint and bone health. So we also look at reduced risk of bone loss and fracture, and improved fertility as well. and glutathione, the whole antioxidant aspect, and the normal methylation process is obviously sort of related as an anti-aging as well. So I've discussed managing homocysteine. So this is really sort of just going over homocysteine control now. So we know that B6, B12, and folate, certainly in combo, can help restore homocysteine levels, regulate methylation, and help normal neurotransmitter metabolism and release. So our homocysteine control contains a synergistic blend of bioavailable nutrients, B6, B12, and folate, folic acid, and we've looked at the dosages that have been shown to maintain or lower homocysteine levels. We recognise that a lot of people have issues with swallowing, so we've kept the tablets nice and small. We've used a sustained release delivery system, so nice slow release. And we've combined it with split dose treatment. Now, there are issues with certainly oral consumption of vitamin B12. It's known to decrease as the oral dose increases. So sort of over-consuming or sort of taking large amounts of vitamin B12 orally are not necessarily the best way to supplement with B12. So we split dose. This helps to achieve optimal plasma levels throughout the day. So therapeutic applications. So who would you recommend this to? So again, this is really kind of an overview of some of the states that I've already spoken about. So we've got cardiovascular disease, so it's going to help anybody who's sort of had previous heart attack or reduced heart attack, stroke, vascular disease. Move on to mood disorders, so we've got depression, schizophrenia, bipolar syndrome, and neurodegenerative diseases as well, not just Alzheimer's, but we have Parkinson's and Huntington's disease as well. Muscular dystrophy, and MS. What particular pregnancy complications? Right, okay, I'll just answer some questions towards the end. It's more I think it's more to do with the issue with folate during pregnancy, so it's more neural tube defects. Okay, so we have our nutritional information. This is homocysteine control. Per tablet, we have 8 milligrams of B6. Obviously, we've got the bioavailable version. Again, vitamin B12, bioavailable, and folic acid. And the directions for use, as I said, it's split dosing. So we recommend 1 tablet a day, 2 to 3 times a day. The general sort of advice is not to exceed the above dose unless advised by a health practitioner, and we take the tablets with food for optimal absorption. The product's free from dairy, gluten, lactose, soya, yeast, artificial colorings and flavorings. We don't test anything on animals, and it's non-GMO. Okay, so this is a brief summary of the product in one nice, easy slide for you, summarizing the product. So again, folic acid, B6 and B12, we formulated to prevent and reduce elevated plasma homocysteine, and this helps to convert it into essential proteins that are involved in processes such as sleep, mood regulation, and glutathione. We utilize a slow-release delivery system, and we use bioavailable forms of each ingredient. So the product lowers homocysteine levels, and by doing this, we're going to support cardiovascular function, we're going to support a healthy mood, nice support for methylation pathways, neurotransmitter metabolism, red blood cell formation, neurological function, and DNA and protein synthesis. And a few just side-by-side bits about the product. Highly bioavailable, it's easy to swallow, we split dose, We use a sustained release tablet, and the key areas are that the product offers benefits for cardiovascular health, brain function, and for optimal mood balance. So that's that for homocysteine control today. If there's any questions, I'll be happy to answer them. If anybody wants any information or wants to email any questions, these are my details here. We will be having some more in-depth webinars probably in the near future, hopefully sometime this year, giving a little bit more detail on some of the evidence relating to homocysteine and regulating homocysteine levels in numerous conditions. So keep your diaries free. I've got a few people typing away here, so I'm happy to answer any questions if they come through. Right, okay, Julie. Yes, there is a role certainly for B complex. This is a product that has primarily been formulated for regulating homocysteine, however. The presentation will be available as a webinar on YouTube. The webinar, if you don't have access, that we can provide a link, or we can also email directly the slides if there are sort of issues with that. There are, okay, yeah, thanks, Daryl. It's very likely, actually, yes. One of the sort of key therapeutic areas really is for the role of homocysteine. Elevated homocysteine does play a very significant role in depression, and if you can provide key nutrients to help sort of convert homocysteine into SAMe, for example, then it's certainly going to be beneficial for the production of various neurotransmitters. And I can see if I can dig out any references specifically to manic depression for you, if you like. What level of time would you use it? As in how long for? I wonder if you mean. Yes, okay. For those, I guess for those individuals who know that they have high homocysteine levels, if you're having your homocysteine levels tested, then you would probably look at using a sort of higher dose until you know that your homocysteine levels are sort of more normalized. Then as a product on its own, you could take a slightly lower dose sort of long term. Right, okay. I'm just going to once again thank everybody for attending today's webinar. As I said, there will be a webinar on the 24th of the month. I believe it's the 24th of the month, and we will be talking to you about neurobalance. So thank you very much for coming, and on that note, I will say good night to you.